While hospital bursting at the seams in the national capital, they are packed completely. Delhi patients are travelling to neighbouring Punjab to seek treatment there. Hospitals in Punjab have been witnessing an increased load of patients from outside the state. But with the patients coming in large numbers, Punjab hospitals are also beginning to face the shortage of oxygen and beds. Here's a ground report.
Harsh and Bhavna are siblings who live in Delhi, but they have travelled all the way to Mohali in Punjab to get their father treated. Harsh, an undergraduate student in Delhi University, talks of the family's harrowing experience in Delhi.
दिल्ली में तो बुरा हाल है वहाँ पे तो यहाँ पे मेरे थोड़े रिलेटिव्स थे तो उनसे फिर बात करके ऑक्सीजन की कमी है नहीं यहाँ पे सारी इंक्वायरी करके फिर यहाँ पे किया एडमिट किया फिर।
और लाए कैसे, प्राइवेट गाड़ी से?
नहीं, एम्बुलेंस से।
और क्या हालत है आपकी?
अब ठीक है थोड़ी,
क्योंकि दिल्ली में इतनी बुरी हालत है, किसी भी हॉस्पिटल में एक बेड तक नहीं है। मेरे फादर की हालत इतनी बुरी थी, ऑक्सीजन लेवल बहुत कम जा रहा था, लेकिन उन लोगों ने बेड तक नहीं दिया, जिस वजह से हमें रातों रात एम्बुलेंस करके इधर आना पड़ा किसी के थ्रू। RT-PCR टेस्ट कराया, उनका पहले नेगेटिव आया, तो हम किस पे रिलाई करें फिर, किन रिपोर्ट्स पे रिलाई करें?
उनको सिम्टम्स
आ रहे थे। इवन मेरा भाई और हम तीनों ही एक घर में रह रहे हैं। वो पॉजिटिव है, मैं नेगेटिव हूँ। डैडी की रिपोर्ट नेगेटिव आई पहले, फिर हमने प्राइवेट में जाके करवाया टेस्ट, वहाँ पे पॉजिटिव है।
Punjab hospitals are seeing an increasing load from outside the state.
If beds are available, we are refusing nobody. We are taking pandemic as a concept of one nation and we have to fight it collectively. But situation in Punjab till date is pretty under control and we are able to provide beds to each and every patient.
A few kilometers outside Patiala, Alok Sharma and his wife wait outside a private hospital. They too have come all the way from Delhi. But not everything is smooth in Punjab hospitals either.
पूरा ग्रॉस मिसमैनेजमेंट है। यहाँ पर हम पेशेंट को लेके आए, हमसे 1 लाख रुपए एडवांस लिया इन्होंने कि आप पहले पेशेंट को लेके आए, 1 लाख रुपए एडवांस दीजिए। दिल्ली से बहुत पेशेंट आए हैं जी, दिल्ली से, गुड़गांव से बहुत पेशेंट आए हैं। कमर्शियल बना रखा है इन्होंने, सबसे पैसे ले रहे हैं और एडमिशन दे रहे हैं। जो लोकल आ रहे हैं उनको ये मना कर रहे हैं।
Punjab hospitals are also facing oxygen shortage and battling to cope with the increasing number of serious patients.
ऐसे क्या कहते हैं कि आप लोग कोविड पेशेंट के पास में जाएंगे। जब हम अंदर गए तो फिर वहाँ पर जाके देखा इतनी ज्यादा मैस है, इतनी ज्यादा गंदगी है। प्राइवेट रूम में उनसे खाना नहीं खाया गया, खाना बिखरा हुआ है।
But desperation is driving people to travel long distances to another state in the hope that they will get the treatment they are looking for.
Amid shortage of oxygen in Delhi, several of those patients and their kin are making an exodus to Chandigarh and Punjab. For now, they're barely making it, especially for local people as well as those coming from other states. But this could be a crisis in waiting if this oxygen problem is not resolved. With camera person Sachin Chandok, this is Kamaljeet Sandhu in Chandigarh for India Today.
Kamaljeet Sandhu reporting from Mohali in Punjab is now joining us. Kamaljeet, what is the situation right there? Many people from the national capital, because of the healthcare infrastructure collapse, are now preferring to go to Punjab and many other parts in North India where there are beds and oxygen available. But I believe now that even Punjab is going to start to face the shortage very soon of oxygen and of beds. What's the latest situation looking like?
See, comparatively, if you compare it with states like Delhi, situation in Punjab is much better. The cases are quite less comparatively. But remember, there seems to be a burden coming in because there are people who are traveling from Delhi and other states who want treatment. There are several big hospitals right here in Punjab and in Chandigarh. That is what they're really looking at. We've spoken to several people, including officers from central government who've sent their families right here in Punjab. But remember, Captain Amrinder Singh has been tweeting about it yesterday, late in the evening. He said there is a major crisis of oxygen. Now, there have been reports coming in from cities like Patiala, from Amritsar, where people have died because of lack of oxygen. We spoke to several doctors. They're saying, especially the smaller hospitals, who are talking about oxygen supply not coming in, rushing in patients in the middle of the night, telling the kin to take them away. Situation similar to that being Delhi. But comparatively, since there is not much media presence in certain areas, these go largely unreported. But situation is increasingly worrying. We spoke to doctors who said the positivity rate is increasing. There are newer areas of influence of COVID-19, and all this has to be now looked into clearly. This is a handful. And we've also seen Captain Amrinder Singh reach out to the Indian Army as far as reviving old defunct oxygen plants are concerned, asking BSF to have a COVID management center right here in Punjab. Remember, this is the western border with Pakistan where BSF is on the first line of defense. So clearly, Captain Amrinder Singh sounding alarm much before, because he knows if the situation has to be there, it cannot go the same way as Delhi. But with numbers coming in from the neighboring states, including Delhi, it means there are doctors who are overwhelmed. There is a machinery which seems to be overwhelmed. There is a situation
Kamaljeet, you know, we're going to keep coming to you to get a status check of all that's transpiring right there in Punjab as well, because many people are leaving Delhi now and going to the neighboring states for treatment.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.